Depression is a very common mental health problem, and there is combination of biological, psychological and social factor which result into this problem. And we are going to talk about some common kitchen herbs which have got benefits into the patients or people suffering from depression. So the first one is called saffron, or scientific name is Corcus sativus. So saffron contains the active compounds like crocin and safranal. This have antidepressant properties. So when you use these compounds, then they influence serotonin and dopamine levels in the brain, and these are the neurotransmitter which are known to regulate mood, and therefore it helps in the depression. The second kitchen herb is turmeric or curcuma longa. So the active compound in turmeric is curcumin, and that is demonstrated to have the anti-inflammatory and antioxidant effects. Now, because anti-inflammation and the oxidative effects are resulting into problem, therefore if the oxidative stress and inflammation can be controlled, which actually happen with curcumin, then we can expect some antidepressant effect, and this is known to modulate through the pathways in the brain. The third one, antioxidant kitchen herb, is lavender. Now lavender oil can have anxiolytic or anxiety reducing properties. The scientific name is Lavandula angustophilia. Now, while primarily this is recognized in the effect in anxiety, the reduction of anxiety, and it also has some antidepressant effect, because usually both conditions pre-exist and coexist. Now the fourth kitchen herb we are going to talk about is lemon balm, which is helpful, and the scientific name is Melissa officinalis. So lemon balm has traditionally used for calming effects, and it works by increasing the level of gamma aminobutyric acid, commonly known as GABA, in the brain. So this GABA neurotransmitter is responsible for reducing the neuronal excitability, and also when you use lemon balm, this changes the gamma aminobutyric acid and help in the relaxation. So next kitchen herb is chamomile, also called Matricaria recutata. So chamomile exert its effects because it has mild sedation effect, and this is beneficial for sleep disturbances which are commonly associated with depression. Now the compound it has also bind with GABA, gamma aminobutyric acid receptor, in the brain, and that promotes relaxation and sleep. The sixth herb we are going to talk about today is St. John's wort or Hyperaceum perforatum. So while St. John's wort is more of a traditional herb rather than a typical kitchen herb, but its efficacy is said to be mild to moderate in the depression, and it is widely researched and found very beneficial in mild to moderate depression. Now it is believed to act by increasing the reuptake of serotonin, dopamine and norepinephrine, and therefore it increases their availability in the synaptic cleft, and that improves or enhance the mood. So this is essential that we know the interaction of this with other medication, including the antidepressant, and because it causes the effect to the neurotransmitter affecting the reuptake of serotonin, dopamine and norepinephrine, this should be used under medical supervision because it can affect other antidepressants as well. So seventh herb we are going to talk about today is rosemary, or also scientific name called Rosmarinus officinalis. So rosemary contains compounds like rosmarinic acid, and this might have a neuroprotective and antioxidant properties. So this herb is used in kitchen very commonly and has a direct link with the depression, although it is not as well studied, and its potential cognitive enhancing properties are known to influence the mood. The eighth herb we are going to talk today is basil or Oceanum basilicum. So basil contains the compounds like eugenol and rosmarinic acid, and that act as antioxidant. So while direct evidence of basil's efficacy in depression is limited, its adaptogenic and anti-stress effect might contribute to the mood regulation. So try and use some of these and it may help, but keep in touch and consult your healthcare provider before taking any significant herbal remedies, particularly those which are strong and that can have additive or subtractive effect on the other antidepressant medications that you're taking. Thank you.